the most important part of inauguration, the formal inauguration and the inaugural speech by our esteemed guest, Dr. Y.M. Jayaraj, Vice Chancellor, Pravara Institute of Medical Sciences, Ahmednagar, Maharashtra. He will set the stage for the scientific session to follow. Sir, please.
Thank you. Namaskar. Anugam Pravara Institute of Medical Sciences. Warm greeting and best wishes to all my colleagues at Karpagam Vinayakar Institute of Medical Sciences. Honorable Managing Director, sir. Honorable Principal. Honorable Medical Superintendent. Medical Director. Head of the Medical Medicine Department. And all the clinical staff, all the fellow delegates and resource persons, and all my fellow participants, medical fraternity who have joined this particular Medicon CME arranged by the Department of Medicine of KIMS. At the outset, I am thankful to the management and the principal and the organizers for having reposed faith in me and requesting me to inaugurate this particular scientific session. I'm extremely happy to do this. Number one, I'm really thankful to the organizers for having thought of one very important novel type of theme for this particular CME, namely COVIDology or COVIDization. In fact, we always associate milestones in the history of our civilization to note as to what is the change that takes place in our civilization. So we have Indus Valley civilization and Vedic civilization and so on and so forth. Then this era of science and technology and industrialization 1, 2, 3 and 4. And also the important facet of economic and social development in the form of LPG, that is liberalization, privatization and globalization. Then came a very important concept of this computerization and internet era, when we are all very happy and say that we are moving into 21st century, the third millennium, in a very fascinating style with the advent of computerization, digitalization and industrial revolution 4 and its disruptive technology. Then came a bolt from the blue in the form of a coronavirus pandemic, which is known as COVID-19 pandemic. And nobody predicted it, and nobody even thought of its magnitude and manifestations. The entire world was taken aback because we saw a pandemic only in 1920s in the form of swine flu. Afterwards, whatever pandemics were happening, they were only at lower level, hitting only few states and a few countries, like swine flu or influenza or cholera or various other types of diseases. And we were all under the impression that we have conquered the infectious diseases. And I'm sorry to say that many of the medical professionals thought that we'll not be dealing with the infectious diseases anymore, but in 21st century, we are going to deal more with lifestyle disorders like diabetes, hypertension, and hormonal disorders, and various other lifestyle disorders related to our body, mind, as well as the physiology. But suddenly this particular virus came, and it has revolutionized the entire healthcare system of the world, and it is making us to think not only from the point of healthcare but also from the point of entire culture and civilization of mankind and governance. So I'm extremely happy to be amidst you today to inaugurate, and within the time given to me, 20 minutes, for the next 15 minutes I would like to share my PowerPoint to share my viewpoint from the point of COVID-19 and COVIDology. So very apt title, namely COVIDology and COVIDization. You have used the word COVIDology, in other words, a new branch of science. And I am going to introduce one more time a word called COVIDization. Just like liberalization, globalization and privatization, whatever happens in this world from today onwards is known as COVIDization. The history will be recording that what was before COVIDization and what will happen after COVIDization, not only from the point of socio-economic, psychological development, but also from the point of the healthcare system. So from this point of view, I'll be sharing my areas of concern and at the same time areas of hope for the next 15 minutes. A warm welcome to all of you and season greetings from Pravara Institute of Medical Sciences. Ours is the deemed university having a medical, dental, nursing, physiotherapy, social medicine, biotechnology departments in colleges. And ours is a residential university where 80 to 90% of the students and the staff members stay on the campus. We are located in a rural area near Shirdi in Maharashtra. And the name of the place is called Loni. It is one of the best models recognized by Dr. APJ Abdul Kalam as a live model of Pura. Once again, I am thankful to the organizers and the management of the Karpagam Vinayakar Institute of Medical Sciences. And I thank the managing director in absentia, Dr. Annamalai, and all the other office bearers and management and the administrative staff and the clinical staff of this prestigious institution. Friends, as you know, that this COVID-19, which has given rise to this COVIDization and COVIDology, has impacted medical profession also, medical ethics also, and medical education. Our institutions are closed since March, and our entire ethics is getting questioned, and the entire medical profession is in a confused state as to what is the way out. Thus, there are certain issues of COVID-19, the impact of COVID-19, and challenges of COVID-19 also is having an impact, and this impact has led to some conflicts and also a dilemma. And despite these conflicts and dilemma and this impact, we have to move ahead and find out what is the road ahead for the normalization of the entire world scenario. Hence, research on COVIDology and COVIDization is going to be the order of the 21st century. I'm extremely happy that the organizer told in the beginning itself as to what extent of research has been carried out for the last 7 months, where the entire world body of research is now full of data of COVIDization. At this juncture, I would like to just say that you are not knowing as to what is the fourth paradigm of research. We are still in first, second, and third paradigm. Because of COVID now, we are in the fourth paradigm of research, where we are not doing research at a local level or at a state level or a national level. We are doing research at an international level, and the arrangement of sharing of resources so that at minute to minute and second level, we are sharing the resources and trying to find out, and we are going for meta-evaluation. It is an unprecedented type of research that is being expected, and is also going on, and thanks to all research and COVID warriors. Let me spend 1 or 2 minutes on the impact of COVID-19 pandemic. It is unprecedented. Nobody expected it. It is fast spreading, highly infectious, and it is at all levels. Earlier, if it were to affect a developing country, developed countries would not have bothered, and vice versa. But today, it has affected all levels: villages, cities, states, nations, and globe. And it is all spheres, 360 degree. And it has created a scenario called standstill scenario. For almost 6 months, the entire world came to a standstill, which no one expected and nobody even could imagine. Even lifestyle of every individual on earth, irrespective of the caste, creed, and race, and religion, or nativity, or state, or developed or underdeveloped, everyone's lifestyle has been disrupted. And it has affected not only the basics, but also to the highest order of need. And not only the lifestyle, but it has affected the living process itself, both rich as well as to poor at the global level. Not only the lifestyle and the living process, it has affected life itself, both at personal level as well as public level. I cannot say that it is not happening to me, let the public suffer. Public cannot say that I am not involved. It is affecting each and every one on earth. Thus, there is total disruption of life and living. And there is a threat to life. Nobody is sure as to what is going to happen tomorrow. And in the process, it is defying our entire value system of society and medical ethics as well as general professional ethics. It is also affecting the entire governance of not only of state, but also of the nation and also of the world. The entire world governance is impacted. And there is a total confusion, a warlike scenario happening everywhere. But nobody knows which battle we are fighting for, whether we are going to win the war or not. There is a total confusion, and it is disastrous. What is happening is a very disastrous situation at all fronts, and it is non-discriminative. And it's not only disastrous, but it is disruptive. It is shattering the entire social fabric, the psychological fabric, social, psychological, and economic fabric. And it's disruptive from the point of economics also, trade, commerce, production, technology. We never heard that the international flights are going to be cancelled. We never heard that the railways, the vehicular movement and all is going to be stopped. But the world witnessed it. And it disrupted the cultural order also. It disrupted the law and order, governance, and world order. And thus there is disruption of the living process and life itself. And somebody said 21st century is known for disruptive technology, but they never thought that it's going to have disruption of life and living process, and also quality of life, productivity of and living itself. This is what Corona has taught us. That's the reason why this word Covidology and Covidization as a apt. We also witnessed lockdown, seal down, containment, closure of all human endeavors, schools, colleges, offices, shops, hotels, industry, malls, theaters, religious places, gym, travel, transport of all kinds, hospitality centers, even religious centers, restriction on human activities and movements, functions, marriages, ceremonies, rituals, even last rites, and even the religious places. For the first time, after the dawn of civilization and all, we saw the closure of temples, closure of the religious places. Then, what was happening for the last 500 years was migration of rural people to urban area. And this COVID gave us to a very new phenomena called reverse migration from urban to rural. Very unprecedented type. People started walking back to the native places in carts, in bullock carts, in jet cars, in bicycles, trains, private vehicles, whatnot. And even Vande Bharat scheme was there to bring people from abroad to India. And trains, Shramik Express and so on, COVID expresses, only to take back the people to the native places, which was unheard of. Even during famine or wars, etc., it was not heard of. And loss of employment. This is a very, very disastrous component. Lots of employment to daily wages and unorganized sectors and daily earning and living people. And marginal sections of society, particularly the daily wagers, the migratory workers, have-nots, and household workers. They had a very, very difficult time in managing the entire world. And there is overload. When this is happening, there is an overload on the healthcare sector, agriculture sector, and horticulture sector. So when everyone was coming to stand still, three important parameters did not come to stand still. On the contrary, they were geared up to move in a fifth gear or sixth gear, namely healthcare sector, agriculture sector, or horticulture sector. Agriculture and horticulture sector, they gave us the food, and the healthcare sector gave us the living and life. So hence they became a overloaded sector. Then after September 2020, till March to September, it was lockdown 1, 2, 3, 4, 5, and so on. Afterwards, slowly, the world started realizing that the life must go on, we must face it, and we should return back to normal life. The unlocking process started in phases. Despite the fact that there was increase in cases, and there was a cautious approach, and we started learning to face the challenges. Then, why this confusion and conflicts? The question mark. Why this confusion for the last 8 months? And why the conflicts? And what are the challenges? Let us see. The virus itself was a challenge. We never knew that it is going to be so much a virulent virus. We were not sure of its origin. We were not sure of its reservoirs. We were not sure how exactly it's going to mutate, because all these viruses, particularly belonging to this COVID, SARS and MERS and COVID, this one, they are going to mutate very fast. We never knew what is its survival rate, and we never knew its mode of spread. The source of spread we knew, but no mode of spread. Till recently, we said it's droplet. Now, slowly we are accepting that it could be even the airborne infection. So, the mode of spread, route of spread, the survival of the virus, everything was a question mark. Then disease itself, how it enters, what is its pathogenesis, what is its pathology, what is its pathogenicity, and how can we test it, What is the laboratory diagnosis? What is the clinical manifestation? What are the complications? Nothing was known. Everything was started from scratch. Every day there was a new clinical manifestation. Sorry for the spelling. And every day there is a new complication. First we thought it is a lung disease. Then we thought it is a disease of both heart as well as brain, and it is a question of the involvement of the blood clotting system and hypersensitivity reactions and so forth. Then diagnosis itself was a question mark. Treatment, totally a new phenomena. Then progression, how exactly the disease progresses, and what is the prognosis? We are not sure. And mortality, morbidity. When we saw the scenario of Spain and Italy, we thought that India is also going to face such a type of mortality and morbidity, where people started dying on road, in the hospital, and there was en masse casualty. But luckily, we do not know exact reason. Could be herd immunity or our earlier exposure to COVID-related viruses, etc. Mortality and morbidity in India was not that much, but still it was alarming when compared to America, Europe, and other countries. Then the challenge is in the resource also. Health professionals, nobody knew how to manage the COVID patients. Healthcare workers, they were also supposed, they are also exposed. So everyone was afraid of their own life. At the same time, they have to work. Then hospitals, wards, beds, ICUs, type of medicine, supply of medicine, PPE kits, ambulances, facilities, BiPAP, then oxygen supply, ventilators, basic amenities, and even basic medicines. Everything was a challenge because it was unprecedented. Then epidemiology, though we have got so many models and modules regarding prevention, regarding control, prophylaxis, vaccination, more than that, what is the projection? What is likely to happen? There are so many projections. It is likely to come down in September, likely to come down in August, but we are in month of November. But now epidemiologists are predicting that there could be second or third wave. Already Europe and America is seeing the second and third wave, and community spread is already started taking place. Then policies and perspectives also are challenges. Nobody knows that there is an act called Disaster Management Act 2005, which gives maximum superpowers to a district management to take over a college, to take over a hospital, to make everyone to work round the clock, and so on and so forth. Nobody knows the impact of this disaster management. But because of COVID, we are able to understand this. Law and order was a problem. You saw on TVs how exactly this law and order, because of confinement, containment, and isolation, quarantine, so many words were introduced which they were never heard of. The demand and supply of food and medicine was a question mark. Travel restrictions, quarantine, isolation, lockdown, seal down, and the challenges to the basic communities, everything was a new thing for the people. So today, everyone knows what is the meaning of quarantine, isolation, lockdown, seal down, even quarantine also. Earlier quarantine principles are different, today's quarantine principles are different. Isolation concepts are different in the beginning, now they are different. In other words, every day there is a change. Now, conflicts. This challenge has led to conflicts. Now there is a lot of conflicts among lawmakers, healthcare providers, and healthcare professionals. There is a conflict, what I should do, what they should do, and both of us should do. And there is a conflict amongst health professionals versus healthcare workers. Who should give the medicine, who should treat the patient, whether the nurse or the doctor or both, and whatever support is to be given, nursing care support, medical support, and healthcare support, and rehabilitation support. And there is a conflict amongst health science, healthcare researchers, and health professionals. And there is a conflict amongst government as well as media on suppression or exaggeration of the facts and figures. And there is confusion, conflict in the management of COVID-19 cases. Just now, thanks to the head of the Department of Medicine, who gave a very good presentation as to what was the initiative of Karpagam Vinayakar Institute of Medical Sciences in the management of COVID from the first day till now. And this confusion and conflict of the management of COVID-19 was in terms of medical treatment, health care, rehabilitation, preventive care, and prevention and control, as well as even giving the medicine itself. So the conflict and confusion was there on the protocols also. Every day WHO was changing its protocol, ICMR was changing its protocol, Government of India, state governments were changing their protocols. Every day was a new phenomena. Once regarding hospitalization. To start with, we said anything hospitalization. Today we say hospitalization is not required till a person requires oxygen. So there is a confusion and conflict regarding hospitalization, regarding testing, whether RT-PCR testing or TrueNAT testing or rapid antigen testing or antibody testing. There is total confusion and conflict. Quarantine, as I told in the beginning, first we said anyone for 15 days to 30 days quarantine. Today we say house quarantine. Once upon a time, quarantine in a designated place. Hotels were converted to quarantine places. Isolation. How long a person should get isolated? Was the question. Again, the duration of the isolation went on changing. Diagnosis itself. Regarding the diagnosis of COVID, every day new clinical manifestations came. Regarding treatment, as Madam rightly said, to start with, we said hydrochloroquine is going to be the order of the day. Then some antibiotics were said to be very good, and then remdesivir and favipiravir and so many other anti-inflammatory and anti-hypersensitive drugs were meant, which were meant for some other diseases, were said to be the treatment for COVID. But now we know, recently WHO said even remdesivir, which is being given vastly for everyone, is of no use. But we don't know the truth. Even hydroxychloroquine, the research said to start with it is a good medicine. Now we say it's not. So today we have gone to only symptomatic treatment. Today that has become the order of the day. That is heparin and steroid and vitamins as well as zinc and various other types. But in other words, we do not know. And giving oxygen itself has become a rehabilitation means. Follow-up. How long we should follow was the question. Discharge. When to discharge? How long the patient should be there in the hospital? Prevention, control. At the village level or block level or the state level, nobody was. Prophylaxis. Only cleaning was the question now. Prevention. And how to dispose of the kits, PPE kits and all. How to prevent the disease. Prophylaxis is still a long way to go. Except chemoprophylaxis, we don't have a vaccine as in today, though research is going on. Research output. Thanks to the organizer, Dr. Ramachandran, he gave a very good important information about research output. Actually, every day more than 200 plus papers are coming out from the point of fundamental research to that of applied research. And family and community engagement is, many of family members have not seen their parents or children for the last 6 to 7 months. And there is a total disruption in family and community engagement. The final outcome of COVID-19 pandemic is dilemma in medical practice. I will not touch the dilemma that is there in socio-economic psychological factor because that is not the topic for today's discussion. In covidization, covidology, let us confine ourselves to the medical practice. So there is a dilemma in medical practice, there is a dilemma in treatment, there is a dilemma in healthcare practice and rehabilitation, and it has led to a dilemma in medical ethical practices and health professional education. When the medical colleges are going to reopen, when the students are going to come back, how long they are going to be confined to their homes or to the hospitals, when they are going to come to the hospital, etc., all are a question mark. Hence, this dilemma, conflict, confusion is there at all levels and all spheres. Then, question is, what is the impact of this COVID on medical practice, treatment, and medical ethics? Let us see for the next 5 minutes. Let us start with medical ethics. See, medical ethics, there are certain rights, duties, and do's and don'ts. There are certain natural rights, constitutional rights, fundamental rights, state rights, and human rights. They're all legalistic. Then there are certain values which are of society, community, social, and cultural part. And as doctors, as healthcare workers, and healthcare professionals, we have got medical ethics or health bioethics. Then at individual level or the conscious level, as a doctor, or as a healthcare workers, or as an educationist, or as a citizen, we have got moral do's and don'ts and duties. And all these 4 components are interdependent, complementary to each other, independent and overlapping. And I will be concentrating mainly on medical care, treatment, and medical ethics in the context of COVID-19. See, in medical ethics, we say that there are 4 major principles, namely the do's and don'ts, code of conduct, and the work ethics in case of the health professional practice or medical practice. And this has become a challenge, especially in the era of covidization and covidology. We always say respect for autonomy of patient and health professionals and healthcare workers, informal consent, freedom of choice, privacy, confidentiality, all of them come under autonomy. Then non-maleficence, that is, do not cause harm to the patient directly or indirectly. Then this beneficence, whatever you do should be for the benefit of the patient, and it should be timely, and you should do good. Then justice, fairness, equality, non-prejudice, context, and all.